Graves' disease is an autoimmune disease of the thyroid gland that can have a profound impact on the quality of life of people who develop this disease. Fortunately, there is good news. Scientists are on the verge of a breakthrough in the treatment of Graves' disease. Stick around to learn more. Graves' disease is an autoimmune disease that results from the sensitization of the immune system to the TSH receptors found on the surface of cells in the thyroid gland. TSH is a hormone that is produced in the pituitary gland and that stimulates the thyroid gland to produce thyroid hormones. Sensitization of the immune system to the TSH receptor causes the immune system to produce antibodies, immunoglobulins, targeted against the TSH receptor that we call TSH receptor autoantibodies. These TSH receptor autoantibodies stimulate the thyroid gland in much the same way that TSH does, leading to an overproduction of thyroid hormones. It is this excess of thyroid hormones that leads to the symptoms of Graves' disease. For the past 70 years, 3 modalities for the treatment of Graves' disease have existed: medications, radioactive iodine ablation of the thyroid gland, and surgical removal of the gland. But none of these treatments is perfect, because 50% of persons who are treated with medications suffer a relapse after the medication is stopped, and radioactive iodine ablation and surgical treatment of Graves' disease carries a high risk of hypothyroidism, requiring lifelong thyroid hormone replacement medication. Because of these shortcomings, scientists are actively pursuing new therapies, alternative therapies that are more specific to the thyroid gland. Thyroid-stimulating hormone receptor antibodies are formed in certain cells in the immune system known as B cells. Because of this, it is believed that by decreasing the numbers of circulating B cells, or by interfering with their function, we can decrease the production of thyroid-stimulating hormone receptor autoantibodies that are the underlying cause of Graves' disease. Since 1997, rituximab, a monoclonal antibody, has been successfully used to treat a variety of autoimmune diseases. Rituximab decreases the number of B cells in the circulation by binding to a CD20 receptor found on the surface of the B cell. In fact, within hours of administration of rituximab, the numbers of B cells in the circulation are decreased by 99%. And this is an effect that lasts anywhere from 5 to 20 months. Scientists have also discovered that another receptor found on the surface of the B cell, the CD40 receptor, is crucial in the activation of T cells by B cells. B cells use the CD40 receptor to bind to another receptor found on the surface of T cells called the CD154 receptor. By binding the CD40 receptor to the CD154 receptor on the surface of the T cells are activated. And activated T cells are crucial to the propagation of the immune reaction taking place in the thyroid of patients with Graves' disease. Another monoclonal antibody, iscalimab, binds to the CD40 receptor and prevents the activation of T cells. A third approach currently under investigation is the inhibition of the neonatal immunoglobulin Fc receptor, which is a molecule that is involved in the recycling of immune globulin G. This means that this molecule also recycles TSH receptor autoantibodies, increasing their survival or half-life in the body. By blocking the neonatal immunoglobulin Fc receptor, we can prevent and inhibit the recycling of immune globulins, essentially increasing their rate of elimination from the body. Efgartigimod and rozanolixizumab are two molecules that bind to the neonatal immunoglobulin Fc receptor, inhibiting it. A fourth drug currently undergoing evaluation targets the B cell activation factor, or BAFF, which is a molecule that is found on the surface of certain cells that present alien proteins, that is, antigens, to B cells for activation. By blocking B cell activation factor, we can prevent B cells from developing further into plasma cells, which are the cells that are directly responsible for the formation of TSH receptor autoantibodies. Belimumab is a monoclonal antibody that binds to B cell activation factor, essentially inhibiting its function and preventing the further activation of B cells. Finally, scientists are looking at a variety of therapies that directly target the TSH receptor. One such therapy involves the recreation of tolerance to the TSH receptor by the immune system by the administration of small amounts of proteins derived from the TSH receptor itself. This method of therapy works in much the same fashion that allergy shots work in desensitizing patients who are allergic to common allergens, such as pollens or certain foods. One such mixture of proteins currently undergoing evaluation is ATXGD59, which is a mixture of TSH receptor derived proteins which were given below the skin subcutaneously at 2-week intervals to patients suffering from Graves' disease. 50% of those patients were cured of their Graves' disease, and 70% experienced improvement of their disease. Future prospects for the treatment of Graves' disease certainly look promising, and we should expect a number of these exciting and new therapies to appear on the market very soon. Thank you for watching. It is only with your support that we're able to continue providing you with these programs. To support the channel, subscribe to the channel. And don't forget to share the video with friends and family. Leave your comments in the box below. Until the next video, stay healthy and stay safe.